Families and advocates of people incarcerated in the state's prisons say more needs to be done about the conditions inside, and they're reacting to a report out of the U.S. Attorney's Office accusing the Department of Corrections with violating prisoners' Eighth Amendment rights by failing to adequately address their mental health needs.
Boston 25 News reporter Crystal Haynes spoke with advocates who work closely with the prison population, and they say conditions have deteriorated since recent COVID-19 outbreaks.
It was a bombshell announcement from U.S. Attorney Andrew Lelling's office Tuesday. A 2018-2019 investigation found that the Massachusetts Department of Corrections violated the Constitution by providing poor access to mental health care and subjecting inmates to periods of isolation months beyond the MDOC's own 14-day policy.
We've just seen it time and time again, like the DOC's only approach to responding to people's health in prisons is through subjecting them to inhumane conditions.
Ayanna Alberg is a founder of Families for Justice's Healing and works closely with prison populations. The 28-page U.S. Attorney's report details poor training of COs, little to no access to psychiatrists, and failure to prevent or respond to incidents of self-harm. Quote, 3 prisoners told us that correctional officers gave them razors specifically to self-harm.
I experienced seeing my friends in mental health watch, and they disappear.
Leslie Credle works with the National Council for Incarcerated and Formerly Incarcerated Women and Girls. The report also cites one incident at the Sousa Baranowski Correctional Center where staff didn't intervene for 45 minutes after an inmate cut himself and was bleeding out.
The prison, the medical service that gets provided in jail is inadequate, and right now it is non-existent.
Lelling's office says since 2018, 4 of 8 MDOC prisoners who died by suicide were on mental health watch at the time or days prior to dying. Quote, counseling, group therapy, individual psychotherapy, or therapeutic activities were not provided to prisoners on MDOC's mental health watch. Alberg and Credle say these conditions have only been exacerbated by the COVID-19 spread in the MDOC.
I have people in there that call me that don't have mental health issues, and this COVID lockdown has triggered something for them.
So we really need like state officials and the entire state to like step up, and part of that again is through decarceration and reallocating resources into services that people really need.
An MDOC spokesperson says in a statement, in part, the department is deeply committed to the health and well-being of all entrusted in their care, and they are working on reforms. Reporting in Boston, I'm Crystal Haynes, Boston 25 News.